The purpose of this guide is to provide patients and their support systems, caregivers, with the information they need to know about their upcoming joint replacement. It is designed to help prepare them for the operation, hospital stay, and recovery. Welcome to Emanuel Medical Center, where we strive to provide high-quality, compassionate care with a great experience to every patient, every time. Living with a problem hip or knee can be frustrating. Pain may keep you from doing what you like or need to do. Joint problems can have many causes, including damage from overuse, injury, or medical problems, such as arthritis. No matter what the cause, the weakness or pain that you feel is disrupting your life. You may find it hard to do your job, exercise, or keep up with your daily errands, and your family or social life may be strained as a result, but relief may be within reach. You may have tried other treatments which didn't relieve your pain. Joint replacement surgery is a comprehensive surgery, and we at Emanuel Medical Center want you to know what to expect before, during, and after your surgery. You can rest assured your medical care is in caring, capable hands. We provide our patients with exceptional care and reassurance for a successful recovery. We will help you through the entire experience and help you resume a more active lifestyle. You've been living with pain and disability, and we can help restore your body. Let the healing begin. Sincerely, Emanuel Medical Center, Orthopedic Surgery Team. Your care team has many players, all with your best interests and health in mind. Let us introduce you to each piece of the puzzle. You are a participant in your own health care, and your active involvement is an important component in getting you back home and back to the life you led. Orthopedic surgeon, a specialized physician who will perform your joint surgery and direct your care. This doctor follows you through office visits and directs your rehab. Physician assistant and/or nurse practitioner, a healthcare professional who works directly with your physician to diagnose and treat healthcare problems and is involved in your care before, during, and after total joint replacement surgery. Anesthesia provider, a physician, anesthesiologist, or specially trained nurse, CRNA, responsible for putting you to sleep or numbing your legs during surgery. Registered nurse, RN. RNs are responsible for your daily care after surgery. RNs follow orders given by your physician, administer medicine, and monitor vital signs. RNs provide education to you and your family about your health and safety needs after surgery. Physical therapist, PT. Physical therapists direct your rehab after your total joint replacement to help you regain strength, range of motion, and balance after surgery. They will provide instructions on how to transfer, walk, and use stairs safely with your new joint. They will instruct you on how to use a walker, which will be needed temporarily after your surgery. Occupational therapist, OT. The OT provides techniques and strategies to complete your daily activities, such as dressing and bathing. They provide instruction on adaptive equipment, which may be needed to perform self-care tasks. They also provide tips on conserving energy and creating a safe home environment. Case manager discharge planner, an RN who works with your joint replacement team to assist your transition into your home setting. They will guide and direct you through the discharge process, arranging home or outpatient therapy or other needed services. They can also answer questions about insurance coverage for services and equipment. Hospitalist, a doctor who specializes in the care of patients while they are in the hospital. Your coach, a family member, friend, or partner who is planning to support you and aid in your care and recovery. You and your coach. Our goal is to work with you to assist in your recovery and get you home as quickly as possible. To accomplish this goal, we ask that all patients perform their required exercises, follow discharge instructions, and make every effort to be an active participant in their care. Coach checklist. Make sure you understand how to set up a home base, equipment needs and how they are used, how to manage pain, signs and symptoms of infection, discharge instructions, signs and symptoms of blood clot and/or pulmonary embolism, how to use the incentive spirometer, movement restrictions, how to assist the patient out of bed, how to assist the patient up and down stairs, how to assist the patient in and out of the shower, the exercise program to follow at home, diet restrictions and recommendations. Please ask your surgeon or a member of your care team if you are unsure about any of the items on this checklist. Pre-surgery. How to prepare for your upcoming joint replacement surgery. Obtain a medical evaluation. A medical evaluation needs to be performed weeks to months in advance, as directed by the surgeon. You may need to see your primary care physician or a specialist. This is to ensure that you are in optimal health prior to undergoing your operation and anesthesia. This may involve heart testing, a blood draw, and an X-ray. You may be asked to start a new medication or have some of your current medications stopped and have additional pre-procedures done depending upon results of your testing. Pre-admission testing. A pre-admission coordinator will contact you to schedule an appointment 7 to 10 days before your procedure for pre-registration and a meeting with the preoperative nurse. You should bring with you all test results from your medical evaluation, all current home medications, and any other information as directed. This will be your final medical evaluation and instructional session prior to surgery. Changes to your current medication regimen may be initiated, as well as additional lab tests and X-rays. You can reach the preoperative department at 209-664-2545. Billing for services. Avoid billing surprises by contacting your insurance carrier ahead of time to determine what will be covered and what will be your financial responsibility. You may also contact the preoperative department at 209-664-2545 if you have any questions regarding your insurance coverage. Advance Directive. The law requires that everyone being admitted to a medical facility is given the opportunity to make an advance directive, also called a living will, concerning future decisions regarding medical care. If you have already prepared an advance directive, please bring copies to the hospital on the day of surgery and provide them to pre-admissions during your appointment. Home medications. You will be instructed to stop any medications that increase the risk of bleeding at least 7 days prior to your surgery, unless contraindicated due to a specific heart disease. Discuss all medications with your surgeon during your initial medical evaluation. Examples of these medications include all anti-inflammatory medications such as aspirin, Motrin, naproxen, and vitamin E. If you are on Coumadin, warfarin, or enoxaparin, special instructions will be given to you for stopping it. Do not take medications for diabetes on the day of the surgery unless otherwise advised by your physician. Do not stop taking or start taking any new medication without checking with your physician first. Before surgery. If you are planning to have any dental work done, such as pulling out a tooth, schedule it well in advance of your surgery. Due to the risk of infection, do not schedule any dental work, including routine cleanings, for several weeks after your surgery. Do not get a spa manicure or pedicure before surgery. Ideally, fake nails and nail polish are to be removed prior to surgery. No smoking 24 hours prior to surgery. It is best to avoid smoking for at least 3 months prior to surgery to prevent infection. Contact your primary care physician for alternatives. Do not eat solid food after midnight the night before surgery. You may have clear liquids as instructed by the pre-anesthesia testing center. Take the medications you were instructed to continue by the pre-anesthesia testing center. Only take diabetes medication as directed by the pre-anesthesia testing center. Preparing your home for recovery before surgery will help make this period safer and simpler for you and your coach. Simple changes can go a long way toward making your transition from hospital to home easier and for preventing injury to your new joint. Remove possible hazards and widen pathways as needed to make it easier to walk around safely. Keep items you use often within easy reach. Move items so you're not reaching up high or bending down low. Move electrical cords out of the way. Check out your usual sitting areas. You may be using a walker for up to 6 weeks. Think about moving around your home with a walker. Make plans to have family members available when you leave the hospital, or tell your care management team that you live alone and have no social network to assist you. You may need assistance with meal preparation and personal care. Stock your home with at least 1 week's worth of pre-prepared meals. Have your house cleaned, laundry done, and make arrangements for care of pets. Some changes may need to be made to your bathroom for safety reasons. Install grab bars around your shower for support, handheld shower for easier bathing, and commode chair or elevated toilet seat to raise the height of your toilet to make it easier to rise. At-home preparation of surgical limb. To reduce the chance of infection, you will need to use a special soap to shower pre-surgery and refrain from shaving the operative limb beginning 2 days prior to surgery. Detailed instructions will be provided to you at your pre-admission appointment. Packing for day of surgery. Pack personal items you will need in the hospital so you don't rush. Personal hygiene products such as a toothbrush, toothpaste, deodorant, etc. Pack 2 sets of loose clothing and well-fitting, non-skid, non-slip, hard soles, shoes or slippers, flat shoes, no flip-flops or house shoes. Bring your CPAP machine if you have sleep apnea. This is very important when you are taking some types of pain medications, and distilled water if a humidifier is used. Bring your insurance card, driver's license, or photo ID. Bring a list of personal contact numbers. Do not bring home medications except difficult-to-obtain medications that your hospital may not carry, and you have been instructed not to stop. Do not bring jewelry, valuables, expensive electronics, or large amounts of money. The morning of surgery. Please take the medication as instructed by the pre-anesthesia testing center on your assigned surgery day. Only take diabetes medication as directed by the pre-anesthesia testing center. Please arrive at the hospital at least 2 hours before your surgery time. Enter through the main entrance on Delbon. Once you check in with admitting, you will be escorted to the pre-op area. A gown will be provided to you. All clothing, jewelry, and other items should be removed, including makeup and piercings. Personal belongings may be given to security or your support person for safekeeping before surgery. You will be assessed and admitted by a registered nurse. They will ask you about your medical history and review your medication list again with you. An IV will be started by a healthcare team member, and a surgical team member will identify and mark the operative extremity with your help. Dentures should be removed and safely stored in appropriate containers before surgery. Further education and post-surgical education will be given by healthcare team member. The average length of time in the operating and recovery room is expected to be about 4 hours. The surgeon will update the family in the surgical waiting room after surgery. A family member should be available before, during, and after surgery to speak to the surgeon. Regional anesthesia. As part of the anesthesia plan, the goal is to provide total joint patients with regional anesthesia. This is an injection of medication near a cluster of nerves to numb the area that requires surgery. This will include a spinal block in your back and possibly a peripheral block in your leg. Regional anesthesia helps with pain control and promotes the ability to walk soon after surgery. Nurses will monitor your legs for sensation, pulses, and your ability to move. Please know that you will be given sedation for these procedures and that your comfort and experience are very important to the anesthesia department. After surgery, you will be taken to the recovery room, PACU. You will gradually wake up during the immediate recovery period. You may feel dizzy and/or nauseous from the anesthesia, and you will have tubes and monitors attached at various points of your body. During this time, additional pain medication may be given if needed. Your vital signs will be monitored, and an X-ray may be taken of your new joint. The nurse will keep a close watch on your recovery and help make you as comfortable as possible. They may ask you to move your extremities to make sure you have feeling and control, especially on the surgical side. Sequential compression sleeves, called SCDs, and graduated compression stockings, called TED hose, on both legs help circulation and prevent blood clots. If ordered by your physician, it is important to tell your nurse if you have numbness, tingling, or other strange sensations in your leg, ankle, or foot. It is also important to tell your nurse if you have sleep apnea, as anesthesia and some pain medications may affect this condition. Once you are fully awake and stabilized in the recovery room, you will be taken to your post-operative room. You will have some degree of pain and discomfort after this surgery, so communicate with your nurse about your acceptable level of pain. The nursing staff will continue your pain medication plan of care and adapt it to your needs. Pain will be frequently assessed during your time in the hospital. We generally utilize the Wong-Baker-Facey's pain scale to accomplish this. Your surgeon will discuss the best plan of postoperative care with you. Some patients will benefit from an overnight admission while most can go home the same day. If you are admitted, you can expect, once you're in your room, your nurse will examine you and will continue to give antibiotics and IV fluids as ordered by your surgeon. Your blood pressure, heart rate, breathing, and temperature will be checked frequently. Neurovascular checks, monitoring the sensation, pulse, and ability to move your leg, will be performed regularly. Fall precautions. Your risk for falls will be assessed. Additional precautionary measures may be taken to keep you safe. These additional measures may include a change in room assignment to move you closer to the nurse's station, a bed alarm, and assistive equipment. This may also result in a medication review at any time during your stay, if warranted. Non-skid socks will be provided by the hospital. You are at high risk for falls after knee and hip replacement surgery. You will have significantly decreased leg function and possible confusion, placing you at a high risk for falls. Please do not get out of bed without assistance. Call anytime for immediate help from staff members. Please call us when you need something, whether it is a drink or help getting to the restroom. It is very important that you have the help of a staff member when getting out of bed. Diet. A clear liquid diet may be ordered after surgery. This is to help prevent nausea and vomiting, common side effects of anesthesia. If you have nausea, inform staff members so they can treat the condition promptly. You may be hungry, but it is important that you stick to this diet. You may be given more food if you are able to tolerate it. Please do not have family deliver food for you on this day. Bladder. Due to anesthesia after effects, you may not be able to urinate normally for a day or so. If you have difficulty urinating, a catheter may be placed in the bladder. Activity. Sequential compression sleeves, antithrombic pumps, SCDs or ALPs, will be applied on both legs if ordered. These pumps help with blood circulation and prevention of blood clots. The goal is for joint replacement patients to be up in the chair within 1 hour of arriving at the post-operative room. Nursing or physical therapy will assist you to sit on the side of the bed, up to a chair for meals, and allow you to walk a short distance if possible. Visitors. On this day, we ask that you consider limiting your visitors to allow you to rest and heal. Blood thinners. Most patients are prescribed aspirin to prevent blood clots. If you have an increased risk for blood clots, you may be started on an anticoagulant. You will be provided with education with your first dose. Additional items. You may have a drain in your operative leg. Nurses will empty it each shift or as needed. Your surgeon will instruct you when the drain will be removed and who will remove it. Showering. You will be unable to get into the shower today due to your IV lines and surgical incision. Discharge. The case manager and your nurse will begin working on your discharge. They will come to speak with you about your discharge options. Have an adult family member available to provide a ride home or to discharge facility by 11 a.m. on post-operative day 1, the day after surgery. Organize friends, family, and neighbors to check in on you after surgery or to be available to help. We recommend a family member or friend be with you 24 hours a day for at least the first week to prevent falls and assist you with those difficult tasks. In addition, make sure you have rides planned for your follow-up visits. It is highly recommended that you organize your home with safety features to prevent accidents. Your care team will manage your care from admission through discharge planning and into the post-acute care setting. There are several options for post-acute therapy with the main goal of helping you transition to your home as quickly as possible so that you can get back to your active life. While your goal is to be discharged directly to home, your surgeon, in conjunction with you and your care team, will determine the best course of post-surgical therapy for you. Based upon evaluation of your progress during your hospital stay, you will either meet the criteria to benefit from a subacute rehab, or your insurance company may recommend that you return home with other arrangements. Therefore, it is important for you to make alternative plans preoperatively for care at home. Insurance does not become involved in social issues such as lack of caregivers, pets, etc. These issues will need to be addressed prior to admission. Patients who return home may have their rehabilitation continued either by home health therapists or in an outpatient physical therapy clinic. Either therapy choice will continue to focus on improving your motion, strength, and mobility. Remember, your goal is to get back home as quickly as possible. You can only accomplish this if you participate in your care and continue home exercises. Some patients qualify and will be discharged to a rehab facility or subacute facility based on their medical needs and progress. Please remember that your insurance company must approve subacute stays. Although you may desire to go to a subacute rehab when you are discharged, your insurance company will check your progress while you are in the hospital. Upon evaluation of your progress, you will either meet the criteria to benefit from subacute rehab, or your insurance company may recommend that you return home with other care arrangements. Therefore, it is important for you to make alternative plans before surgery for care at home in the event that the insurance company does not approve subacute rehab. You can always pay privately if it is your desire to be discharged at a facility. Outpatient PT/OT therapy. Covered by most insurance plans and Medicare, Medicaid, charged per visit, requires physician order, requires a qualifying diagnosis, and ability to get to and from the therapy facility. Frequency duration will depend on your progress. Home health, in-home, covered by most insurance plans and Medicare, Medicaid, charged per visit, requires physician order, need qualifying diagnosis, assistance from caregiver in the home, and infrequent absences from the home. Homebound. Frequency duration will depend on your progress and MD orders. Skilled Nursing Facility, SNF, nursing home type setting, covered by most insurance plans and Medicare. Medicaid does not cover SNF. Please check with your insurance carrier for benefits and in-network facilities prior to your surgery. Medicare rules apply and the first 20 days are usually covered at 100%. Charge per day of stay varies from facility to facility. Rates are negotiated by SNF when pre-authorized by your insurance. Requires MD order and qualifying diagnosis. Discuss your preferences with your surgeon before your surgery. SNF representative may visit you in the hospital before discharge. Speak with your care team. Check availability. Recommend touring the facility prior to surgery. Ask about private rooms, visitation policies, and therapy schedules. You can expect a stay about 2 to 3 weeks. Therapy is usually daily and a slower pace than inpatient rehab. Duration will depend on your progress, benefits, and MD orders. Inpatient Rehabilitation Facility, IRF, hospital setting. Some insurance companies will cover this option. Medicaid does not cover IRF. Please check with your insurance carrier for benefits and in-network facilities prior to your surgery. Charge per day of stay. Rates are negotiated by IRF when pre-authorized by your insurance. Medicare rules apply and are billed as hospital days. Requires MD order? Discuss your preference with your surgeon before your surgery. An IRF representative may evaluate you in the hospital before discharge. Need qualifying diagnosis, which can vary. Most expect the patient to withstand 3 hours of therapy throughout the day and is faster-paced, higher-intensity regimen. You can expect a 1 to 3 week stay depending on your progress. Home health and medical equipment may still be needed and will be arranged by IRF on discharge. Duration will depend on your progress, benefits, and MD orders. Postoperative care. Monitoring for infection, signs and symptoms of infection. Increased swelling, redness, and/or change in color, amount, and odor of discharge. Significantly increased pain in knee, hip area, or incision site. Fever greater than 101.5 degrees Fahrenheit. Prevention of infection. Take proper care of your incision as explained by your physician. Your orthopedic surgeon may have you take antibiotics before dental procedures after your joint replacement. Notify your physicians and dentists to discuss that you have had a total joint replacement. Avoid sick individuals who are suffering from cold and flu. If you display signs of infection, seek out your healthcare professional and inform them of your recent joint replacement. Pain control and incision site care. Controlling your pain. Take your pain medicine at least 30 minutes before physical therapy or exercises. Because of pain medication provided during surgery, an increase in pain may be present 2 to 3 days after surgery once these medications wear off. Inform your physician if pain has not gradually decreased at your follow-up appointment. Change your position every 45 minutes throughout the day. Use ice for pain control. Applying ice to your affected joint will decrease discomfort, but do not use more than 20 minutes at a time each hour. You can use it before and after your exercise program. Caring for your incision. Wash your hands frequently with soap and water. Take daily showers as ordered by your surgeon. It reduces risk of infection and diseases and also helps you feel better. You may shower only after receiving permission from your surgeon. If you are directed to protect your dressing, cover the incision with a plastic bag until informed to stop. This prevents water and other organisms from entering your healthy incision. Keep your incision dry. Do not touch or scratch your incision as it is healing. Do not enter large bodies of water where your incision can be submerged. This includes pools, the ocean, or other bodies of water, including baths and hot tubs. Apply ice packs often to reduce inflammation to your surgical site and relieve pain to the site. Some bruising will develop after surgery. Notify your surgeon if there's increased drainage, redness, pain, odor, or heat around the incision. Inactivity after surgery may cause the blood flow to slow and pool in the veins of your legs, creating a blood clot. If a clot occurs, despite prevention measures, you may need to be admitted to the hospital to receive blood thinners. Prompt treatment usually prevents the more serious complication of pulmonary embolus. Signs of blood clots in legs. Swelling in thigh, calf, or ankle that does not subside with elevation. Pain and tenderness in calf. Note, blood clots can form in either leg. Prevention of blood clots. Do foot and ankle pump exercises every hour. Be active and walk for exercise as directed. Generally, avoid being stagnant or inactive for more than 1 hour at a time. If you are driving far or flying, try to get up and walk around once every hour. It is best to avoid flying for at least the first 30 days after surgery. Wear the compression TED stockings for 6 weeks after surgery. As mobility increases, the need for TED hose decreases. Use blood thinners as prescribed by your doctor. Thank you for watching our Patient's Guide to Joint Replacement Surgery. We send you our best wishes for a speedy recovery.